Hello, my name is Kate Davis and I'm an Associate Professor in Pediatric Prescribing and Endocrinology at London South Bank University in London, England. I'm also a qualified children's advanced nurse practitioner and nurse teacher, and I have been chair of the IMAGE meeting since 2014. IMAGE, or Insights into Managing Growth for Endocrine Nurses, is an annual meeting for paediatric endocrine nurse specialists across Europe and Canada. The first meeting, as I say, was in 2014 in Prague, and myself and Professor Martin Savage have successfully chaired this meeting every year since. Due to COVID-19, last year was online, as this year's will be. But even though it's online, this is still a great opportunity to reach out to nurses across the world and share best practice. With me today is Bailey Tabak from the Hospital for Sick Children in Toronto, Canada. And I'm going to be talking to Bailey about her experiences in attending the IMAGE meeting over the last few years. Hi, Bailey, how are you?
Good, thanks. How are you, Kate?
Good, thank you. So, Bailey, can you tell me a bit about you, where you work exactly, about your role in pediatric endocrinology?
Sure. I worked at the Hospital for Sick Children in Toronto as a pediatric nurse in the endocrine clinic for the last 8.5 years. I'm involved in supporting patients and their families and doing health teaching for the general endocrine population. And then I'm also the case manager coordinating care for the patients that are on growth hormone.
Can you remember the first time you came to an IMAGE meeting, and where was it, or what was the kind of theme that we had on that year?
Sure. My first meeting was in Lyon, France in 2016. And the theme that year was puberty and its disorders. And at that time, I really enjoyed the breakout sessions where the nurses from clinics around the world talked about how they planned for and started nurse-led clinics. They reviewed the competence frameworks and then their abilities to prescribe. That was a session that really stood out for me. And it really opened my eyes to, what an endocrine nurse can do.
So do you like how IMAGE runs different themes each year? Do you think that works quite well?
I do. I think that the themed case discussions, it lends itself to active learning in the group rather than just being a passive recipient of knowledge. And I feel like I retain more information in that format. And it allows me to kind of hone my skills and using the evidence-based practice that's been described. And I try to incorporate those best practices into my clinical care.
So Bailey, have you actually made any changes in your practice after having attended any of these IMAGE meetings?
Yes, I have actually. There was a year that the theme was adrenal insufficiency. And we realized as nurses, we were getting a lot of phone calls from patients, not knowing and understanding when they should give illness or stress dosing of their hydrocortisone that we prescribe. And so we decided as a CPEN group that we would come together and have a workshop to update some of our patient handouts. And so we've created an adrenal insufficiency illness management algorithm that's much easier for families to follow, to understand when they should be giving stress dosing and when they should be giving emergency intramuscular solucortef injections. And so I find that that's been quite valuable. It's easier to understand for families. It's more visual rather than our previous sheet, which had way too many words on it. And so was very well received by the families, and we hand it out to all of our patients now. And another example that I can think of is Katie Frost had done a presentation about motivational interviewing. And so our whole group tries to use that within our practice to help families share information about how they're feeling about their diagnoses and just their lived experience and their history, and just to help them be able to share that information. And again, I found that very invaluable in my practice.
Absolutely. And do you think these kind of meetings work better for nurses who are new to the speciality, or for nurses who've been in the for nurses who've been in the specialty for a little bit longer, or do you think there's a bit of something for everybody?
So that's a great question. And I have been on both sides of that over the years. That first conference that I came to, I feel like it really reinforced things that I was learning in clinic in terms of the pathophysiology and the medications that patients are using and their concerns. And then, as I've had more experience within clinic, the advanced practice presentations from nurses from around the world is something that appeals to me, and I'm hoping that we can do some of that in Canada in our clinics. Sometimes we're limited as to what we can do based on our governing body. So as a registered nurse myself, I can definitely help to set up a nurse-led clinic, but I can't do any prescribing.
So yeah, so we have that advanced role here in the UK actually. So that's quite interesting how our roles differ internationally. So when you thinking about back to when you did your presentation, how do you feel when you're presenting to such a multinational audience? Because it's not just the English speakers from the UK and Canada who are in the audience, but it's a very wide European meeting. We have French nurses there and German nurses. What's that like, trying to communicate best nursing practice to a completely different load of nurses that you're used to?
We are very lucky at this meeting to have interpreters to help, convey that information, which I think is extremely important. And really, I find the networking at these conferences invaluable, because you do learn, what people are doing in other parts of the world, and able to, introduce evidence-based practice into your clinic situation after you come to a meeting like this, and you hear about certain techniques that people are using, or the psychosocial support that they're able to provide to families. And so coming back from a meeting like this, you get energized and excited about putting these things into practice.
Do you think the role of the pediatric endocrine nurse specialist has changed a lot over the years? I mean, do you think there's anything about the way our practice has changed, or a bit more autonomy, or what's it like with you in Canada?
So it's very different in Canada, I find. I feel like nurses outside of Canada have a lot more autonomy in terms of their nurse-led clinics. We could definitely set something up like that at the Hospital for Sick Children, but the focus there is really on training fellows and residents, and so I find that that is not an option for us right now, but we will definitely try and push forward with that. For sure, for the nurses who have the designation for advanced practice, it's definitely, from what I've heard at the image meetings, it's definitely come a long way since nurses began practicing in endocrinology years and years ago. You're able to do some diagnosing and prescribing medications in the UK, which I feel is extremely important for families to get timely visits and assessment. Oftentimes in our clinic, if you have a nurse-led clinic, the families wouldn't have to wait as long, I think, to get in to see the physicians, because their schedules are just so busy. So I think over the years, definitely, it's definitely changed, and nurses are taking on more responsibility for their patients and families.
Yeah, absolutely. I think for the better as well, for sure.
Definitely.
Yeah. Okay, so I think that's pretty much all I want to ask from you. Is there anything else that you want to add or make any comments about?
Um, Other than the fact that I'm really excited for this next meeting, and hoping to see you in the future when we can travel again.
Absolutely. Okay, that's great. Thank you so much, Bailey, for your time today. And as you say, I really hope that we can see each other face to face really soon.
Thanks so much, Kate.
Thank you.